Thank you for having me. And I'll just go ahead and get started. Just to check in, Tony, how much time? Is 20 minutes a good amount of time?
Hey, I'm going to defer to Bob on that one, but I believe that's correct.
Absolutely. That's perfect, Amy.
Okay, great. So thanks for having me today. I'm here to speak to you about suicide prevention. As it was mentioned, this is Suicide Prevention Month, which is every September. VA recognizes the entire month as a time that we should be engaging our communities and across the enterprise to talk about how we can all play a role to end veteran suicide. And specifically, I'm here today to cover these agenda items. I'll give you an update about suicide in the United States, as well as talk specifically about some of the risk in the veteran population. I'd also like to talk to you about the public health approach to preventing suicide that we've adopted here at VA, and then I'll highlight a few other items as well. And can everyone see my screen fine?
Yes, looks good.
Great. Thank you. So many people may be aware, especially in recent months, where we've had some high-profile losses to people who were celebrities by suicide. The public health issue has come back into light. We know at VA this has been a priority for us for many years. It remains a top clinical priority to prevent suicide, but it's also a national problem. Nationally, suicide is a 10th leading cause of death. Many people think, for example, that there's more murders than suicide, and that's not the case. Suicide is something that causes the nation to both spend an incredible amount of money, but also, on average, we lose 45,000 people to suicide. We know that suicide is a veteran issue. It's an issue for active duty service members as well, Guard and reservists. So it's a human issue, and we are really here to try to explain to you what we're doing and to see how perhaps we could do more work together because of your role in communities. And I believe I'll be taking questions at the end. So there are some populations who are at greater risk for suicide when we look at the veteran population. We know that veterans over the age of 50 have make up the largest majority of suicides, of people who die by suicide. Female veterans have concerning rates of suicide, which are higher than their civilian non-veteran counterparts. We know that periods of transition, especially the transition out of the military into civilian life, we can see a rise in suicide at that time. If someone is exposed to a suicide or loss of someone close to them, it can also be a risk factor. And then having access to lethal means for someone who's in a crisis and not doing well can also be a considerable risk. Despite anyone's personal experience with the tragedy of knowing someone who's either had suicidal thoughts or suicide attempts or who's died, suicide is preventable. And this is really a message that we could use your help in getting into communities. It can be a very challenging experience to lose someone to suicide. It causes complicated grief and can leave a lot of us not only feeling like we could have done something more, but it can be a challenging topic to bring up that we believe suicide is preventable for those of us who've also lost people close to us. It's very important, however, that we carry this message. So now we'll cover some details about suicide risk in the veteran population. Please know that this is a very shortened version of a typical presentation, and if there's any way that you would like to have a later or more detailed conversation, please let me know and I'll give you my contact information at the end. Some of you may have seen recent data that we have put out on behalf of VA. which estimates 20 veterans dying each day by suicide. This data is from 2014 and was updated again this year with 2015 data. On average, 123 Americans die by suicide, and so that's a reference point that we think is important, again, to show that this is an issue we all are facing, those of us who've served and those of us who have not. It's important to also see the need to engage our communities because of the veterans who die each day by suicide, it's estimated that only 6 of those veterans were receiving care from the VHA before their death. So we know that a lot of people who need care and need resources are not actually coming in to the health administration. Anytime we talk about risk factors for suicide, it's really important that we also talk about what are protective factors. So connectedness alone is incredibly important for people who are struggling with any type of problem. Problem-solving skills and having access to mental health care are other protective factors that we can take into our communities. Having a sense of mission and purpose, a spiritual connection, our physical health, and as well as our emotional health is really important. There are some risk factors listed here as well, and I mentioned some. Our goal is to, of course, minimize someone's risk factors and increase their protective factors, which we feel that we can do in many ways here at the VA, but also are key for our partners in the community to help with. So of our veteran population, we know that we have over 20 million veterans, and we have a significant amount of female veterans who are now coming in to the VA, but we're also seeing a rise, more female veterans than we've ever had. And for us, that means that we have to think about ways to engage both our male veterans and our female veterans from the point of time that they leave the military so that we can provide them the best access to services and also specific resources that may be unique to them. I mentioned earlier that VA has taken a public health approach to preventing suicide. Some of you may know what that means, but I'll just cover that here as well. The importance of a public health approach to suicide is that you're trying to reach an entire population, not just a small subset. So there's 4 key parts of a public health approach. The first is to define and monitor what the problem is that you're facing. 2 is to identify risk and protective factors, and we've also done that through different innovation projects at VA. We can actually look at data that we have access to provide us with the opportunity to try to intervene with people who may be at an increased risk. 3 is to develop and test those prevention strategies, so like the innovation project called ReachVed or some of the other work that we've done, and then look at what is successful so that we can disseminate those successful strategies widely. The National Academy of Medicine has helped us to create the public health approach that we have. And again, the purpose is to have different approaches for an entire population, like you see here on the left, having a universal approach, for example, where we can try to reach people before they leave the military, so working with our partners at DoD to try to have broad approaches to provide information and resources to people of how they can get help. Then in the middle here we have the SUM category, which is where you look at selective groups. So for example, perhaps people have had a history of a suicide attempt. We might have selective approaches to try to reach those folks. And then indicated, so when you're looking at a smaller sample of a large population, those are strategies where we try to reach someone, for example, with our Veterans Crisis Line. So someone who may be experiencing a crisis and willing to reach out, then we have an opportunity to connect with them. However, there's a lot of people who may have risk factors for suicide or may have had struggles in the past, but they may not identify as being in crisis. So we want to have a range of different interventions. to reach our entire population. As I mentioned earlier, we know about 50% of veterans do not use VBA benefits or health care. And I heard earlier, I think I just came on the coattails of someone talking about benefits more broadly. And so if there's any questions here about this slide, I'm happy to answer those. Hopefully you've all heard about the executive order that the president signed in January of this year. The executive order was to support our veterans during their time of transition out of active duty service into civilian life. The specific executive order is 13822, and it requires us to partner with the Department of Defense and the Department of Homeland Security to create a joint action plan, which we've done. It also requires updates to that plan, and the focus is really here in the bottom three bullets. One, to improve actions to ensure all people transitioning out of the military are aware of the access to mental health services that they have and to give them access. Secondly, to improve actions to ensure the needs of people who are at risk, that they're identified. For example, if somebody has had a suicidal ideation or attempt or struggled with addiction while they were in the military, they would be coming out of the military with an increased amount of risk. And our goal is to connect with them before that transition. And then third here, to improve mental health and suicide prevention services for individuals that have been identified in indicated populations who need care. I'll now go over some resources before opening for questions. Again, this is a pretty quick overview of our approach here for suicide prevention, but I'm glad to have your time. Of course, we have the Veterans and Military Crisis Line. We're trying to engage folks who might be still active duty, National Guard members, reservists, family members, and friends. All of those folks are encouraged to reach out to us. You may have heard that we've opened now 3 call centers. So we have our Canandaigua, New York, Atlanta, Georgia, and Topeka, Kansas call centers for the Veteran and Military Crisis Line. Since it's Suicide Prevention Month, we have a renewed focus on our #BeThere campaign. This campaign talks about ways that you can show up for someone in your life and reach out to them with simple, small acts. So acts of kindness to encourage us to connect to people around us are really important. We know that enhancing connectedness is, in fact, a prevention strategy, and everyone can play a role in that. We have some public service announcements here, and then we also have, again, the campaign #BeThere. You may be already aware of the value that we have in this fantastic resource called MakeTheConnection.net. This is a video catalog of over 600 videos of veterans talking about their own experience with struggling through something in life and how they got through it. The videos are pretty short, but they're very powerful to hear someone's own account of how they made it through some type of mental health challenge. You can actually search on the website by era of service, gender, age range, different options. This is a great place if you know someone who's ambivalent about getting help or not sure if they have problems that other people have faced. It's a great way to engage that conversation. Coaching into Care is another fantastic resource that some people are less aware about. And this is actually a phone line where you can reach out and talk to someone about how to get someone that you care about or someone that you know engaged in care. VA is a healthcare system that stands alone in this respect with an integrated network of over 400 suicide prevention coordinators who work for the Veterans Health Administration. These are licensed mental health professionals spread throughout wherever we have VAs, including outside the continental U.S. These resource folks are fantastic for local engagement and education opportunities in the community. They know the system very well and can help advocate for someone who's been in crisis or someone who's new to the system. They also are responders to people who call the veteran and military crisis line. So a unique point about that call line is that if someone reaches out, their crisis is handled in real time, and then they also receive follow-up the next business day from the closest team of suicide prevention coordinators near them. Our goal is to engage the community and provide the veterans with all of the resources that we can, and of course to avoid another crisis. We have a resource locator link here, and you can actually enter your zip code. Hopefully the folks who are here today actually know your local suicide prevention coordinators. Otherwise, you can search by zip code online. VA has partnered with SAMHSA to establish an innovative strategy of engaging communities throughout the country. It's called the Mayor's Challenge. This challenge was in some ways framed after a similar community-level effort around the homelessness initiative some years back. Our goal is to eliminate suicide by using a comprehensive public health approach that includes engaging communities, especially those where we may see increased numbers of either suicide deaths or suicide rates. So this is a partnership, like I mentioned. This includes collaboration in local communities through both local government and community service organizations. And we've provided technical assistance and support to the local teams as they are trying to strategize to see what more could their local community offer. Currently, we have these different sites. Hopefully you can see them fine. These 7 cities are the first round of cities in our Mayor's Challenge, and we're looking to expand this in the next year. I'd be happy to take any questions. I think we've got just a couple minutes left, and I'm not sure the best way to do that, Tony, so I'll defer to you.
Hey, Amy, this is Bob. Just an observation or maybe a question on, you had mentioned at the outset, the only 6 of 20 engaged or enrolled in or had seen a VHA provider in the recent past, if ever. The last time I checked, Montana had the highest participation rate, and I think that Director Wanda Wright and Thomas Winkle in Arizona had mentioned Arizona's participation rate. But I mean, do you see that as one of the? And Montana, by the way, was 43%. But is there a move afoot to, lessen the crisis by finding these stats?
For sure. Yeah, and were you wondering if there's a move to try to enhance enrollment into the healthcare system, or just
right, just in
more broad
general, is that viewed as one of the strategies?
Yeah, in many ways it is, especially to get information out there about how people can more easily access benefits. So I'm not sure if it was already covered today, but for example, through the Explore VA campaign, trying to create avenues for people to engage and use their benefits in a simpler way. Then another community level effort like this one here, the Mayor's Challenge, is in both Montana and Arizona. And I think there's an effort to not only identify veterans, but to offer them and encourage them to connect with us. But we also know that since we have data about who dies by suicide and we have data about our users of the health administration, we can also then ask local partners to take a look at what they offer service members and veterans. So for example, if there's other healthcare systems in these states, the goal would be to engage those healthcare systems, assure that they have military culture competency and their providers understand what would be evidence-based care, and share some of what we've learned at VA about what works. And that's certainly going on. However, if you have suggestions of additional contacts or people that we should make sure that we're including in the conversation, I'd be happy to take those, especially because of all the connections that you all have in local communities. I would also say there's an effort to explain to communities why safe storage of lethal means matters. So what I mean by that is most veterans die by suicide using firearms. We can do a lot to explain to communities why it matters to think about safe storage of firearms and to offer different options for folks. So one of the things that VA has done for many years is we've offered free locks that go on the trigger of a firearm, and they're not the same, of course, as a large standing safe. But what we find is that anything we can do to slow down someone's thinking when they're in a crisis really matters. So encouraging people to separate ammunition from firearms when they've been in a crisis or when they've been struggling really matters. And those local campaigns, in Montana, there's been a state effort to have safety around firearms through the local communities there. And then we're always trying to play a role in that as well.
Very good. And there was a comment / question from the outstanding executive assistant to the newly appointed Idaho Department of Veterans Services Director, Marv Hagedorn, but his executive assistant, Kevin Lawyer, or someone with the group has posed the comment or question that of the 14 veterans who aren't enrolled in the VHA, is that because they are unaware of services or ineligible for services? And you may have pretty well covered that, but thanks for the observation, though, Kevin, and to you folks in Boise.
Mm-hmm. What I can say about that is we're working more closely with VBA to find out exactly more details about that group. Because, for example, we know that it's not a requirement. If you receive a service-connected pension, you don't have to come to VA for health care, right? But if we know that there's, for example, in a certain state like Montana or Arizona, that there's an increase in folks who have service-connected ratings that maybe are associated with suicide or using our scientists to help find that out, then we can reach out to them. And that's actually on the table right now, our efforts to work more closely with VBA and to take data that they already have and also to think about the frequency of contact that they have with folks who already are receiving benefits to see if we can infuse that with some upstream messaging about mental health awareness and wellness in general. Those are some ideas that we've had, and again, we'd be happy to take more.
Stellar. Thank you so much, Amy.
You're welcome.
Greatly appreciate
Thanks for the opportunity, and I'm happy to provide local contacts or to try to come out and do more detailed presentations for you as well. Hopefully, I can share my contact information through you if you don't mind, or anyone else. Thank you.
Thanks, Amy, and I am going to follow up with you in reference to the great folks in Southern Oregon who are looking for some help, and as we discussed the other day.
Please.
Yeah, thank you so
great.
much.